Okay, so earlier I asked for an AED when I had a non-breathing casualty. An AED is an automated external defibrillator. It's a really clever piece of kit and it can increase the casualty's chance of survival anywhere up to around 75% if it's got to them within the first couple of minutes. So what this piece of kit will actually do is analyse the casualty's heart rhythm and determine whether there's a shockable rhythm. It will try and shock the heart in order to stop the heart to bring it back to its normal beat, normal rhythm. Okay, so I'm just going to open this up and let you see what's in here. It's a really safe piece of kit, it can't harm you, so nothing to worry about. So what you're going to find is potentially a pocket mask, towel, razor and scissors, and the pads that we're going to apply onto the chest later, which I'll explain. So the scissors might be needed if we need to cut off any clothing. So the pads, I'll show you now, these ones, need to go directly onto bare skin. Okay, so we might need to cut clothing off. The razor is used if the chest is particularly hairy in the areas where we're going to place the pads. So we just need to have a quick shave of those areas to ensure the pads are going to stick properly. Pocket mask should be used anytime when you're doing mouth to mouth, so as soon as you have one, use them, and I'll open this up later on the casualty and show you. And the towel is going to be used if we need to dry the areas off, again where the pads need to go, just so we can get good contact to the skin. If we don't have good contact to the skin, then when it does shock, it won't transfer through the heart as we need it to, or it won't be as effective. Okay, so the defib that I'm showing you here is quite a lot smaller than the real defib, but it does act and explain things just as the real one would. Okay, so what I'm going to do now is I'm going to show you on a adult mannequin how to use the AED. Okay, so I'm going to show you how to use the AED now. So I've got my casualty that's not breathing, so I've done my primary survey, I've checked for danger, checked for response, I've opened the airway and checked for breathing, established that the casualty is not breathing normally, so I've asked for them to go and get an ambulance and bring an AED back for me as quickly as they can. Whilst they're off doing that, I'm going to buy the casualty some time by doing my 30 compressions to 2 breaths and continuing that cycle of 30 to 2. As soon as the AED comes back, I'm going to stop what I'm doing on the casualty and I'm going to open up the defib, okay, because this is going to give them the best chance of survival. So if there's anything to the chest that I need to prepare, so drying it off or taking off any clothes, so using the scissors or using the razor if the chest is particularly hairy, then I'm going to prep all of that. Make sure I turn the AED on and listen to the instructions.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So on the pads it does have pictures, diagrams of exactly where they need to go.
Apply pads, plug in connector.
So just do that one at a time.
Apply pads, plug in connector. Analyzing heart rhythm. Do not touch the patient.
Everyone stand clear.
Shock advised. Charging. Stay clear of patient.
No one touch the patient.
Deliver shock now. Shock delivered. Begin CPR.
So as soon as the AED tells you to continue CPR, do so without delay. As you can hear, some of them have a metronome, so it instructs you when to beep, but you're still doing your 30 compressions to 2 rescue breaths. You'll continue to do that for around 2 minutes whilst the defib recharges and then analyses the heart rhythm again, and it lets you know whether it's going to shock or not, and then it will instruct you whether to continue CPR. The only reason you're going to stop is if the casualty shows definite signs of life, or the paramedics ask you to, or you're physically exhausted. Now obviously if you did have somebody else with you, you don't have to be trained to use an AED, although it does obviously give you a lot more confidence. But if you did have someone else, get them to do that whilst you continue to do compressions and breaths, and they can work around you with the defib.